Knock, knock.
Yep.
All right, hello, my name is Allison. I'm going to be your nurse today.
Okay.
Before we get started, I'm just going to use some hand sanitizer. Clean off my hands.
All right.
All right. Can you please tell me your name and birthday?
Sure. It's Andrew McGrath, 7977.
Great. Anything in particular bringing you in today? Chest pain, shortness of breath?
No.
Anything we need to be concerned about?
No.
Okay, great. I evaluated your chart. Your vital signs look good. So just going to begin. Do you mind if we do a cardiovascular and respiratory assessment?
Oh, that sounds good.
Okay, great. I'm just going to start off with just an inspection, just kind of doing a brief overview, auscultation, which is listening, palpation, which is touching, and percussion, some tapping of your back just to evaluate some sounds, okay?
All right. Sounds good.
So just on initial inspection of your chest, you got a nice symmetric chest, equal chest rise and fall. It's cone-shaped and oval-shaped, and I don't appreciate any barrel chest at this point. Also looking in the back, brief inspection. Everything looks good. I don't appreciate any kyphosis or scoliosis, but I'm going to start with some palpation.
Okay.
Okay?
Great.
Really touching right here. Let me know if anything hurts. I'm evaluating for any masses or lesions.
All right.
Not appreciated so far. Respiratory rate's nice and equal.
Right.
Silent. Not notice any cyanosis or stridor. Okay,
Cool.
that's good. Go to the back. No masses or lesions, no crepitus noted.
Mhm.
No diaphragmatic or costal breathing.
Mhm.
Regular, silent. Alright, so I'm going to feel your costovertebral angle. We're going to be evaluating for the symmetry of your chest. So I'm going to be in the T10 area. I apologize, my hands are cold. I'm going to place my hands. I'd like for you to take a nice deep breath for me. And let it out. Okay, the chest appears nice and symmetric. Okay?
Right.
And before we move on to percussion, I need to evaluate the tactile firmitis. So I need to have you say the word 99 for me while I palpate.
All right.
Please say the word 99.
99.
And again,
99.
and again,
99.
and again.
99.
Okay, great. You've got normal vibration, your chest is nice and symmetric, and the vibration decreases as I move down.
Okay.
So now I'm going to move on to percussion.
All right.
Okay, you're going to feel me tap on the back of your chest with my middle finger. Use my middle finger to tap my middle finger. Okay, here we go. So we're at the apex. Staying away from the areas. I'm going to touch the clavicle at the top.
Sorry.
And last one. Okay, moving on to the front.
Mhm.
Start at the apex. And last one. Okay, sounds are nice in resonance. There's a low pitch, hollow quality to them, and there's dullness as I move down the chest.
Okay.
Okay. So the next thing that I'm going to do is I'm going to listen to your lungs, but it's important for me to point out some landmarks that are important at this point.
All right.
The first one is the suprasternal notch,
Right.
and that's located right here, and I'm anticipating bronchial breath sounds when I listen here. Next one is the sternum, It's located in this area, and I anticipate bronchial vesicular breath sounds in this area right here. And the next one is the sternal angle, and that's at the second rib area. And I also anticipate bronchial vesicular breath sounds in this area. And the next area I need to focus on is the costal angle. It's about the 5th rib area, and I anticipate vesicular breath sounds in that area. Okay?
Cool.
So now I'm going to listen in the front, and then I'll move on to the back.
Okay.
Okay? Okay. Nice deep breath. And out. Bronchial sounds in this one. Nice deep breath. Out. Deep breath. Deep breath. And out. Deep breath. Deep breath. One more. Nice vesicular breath sounds noted in the lower lobes. Bronchial vesicular in this area, bronchial in this area. Moving on to the back. Another area that I need to point out is the posterior vertebral prominence, and that is the C7, T1 area, where I anticipate hearing bronchial vesicular breath sounds in this area. Okay? All right, here we go. Nice deep breath. Starting at the apex. And last one. Okay. Lungs are clear to auscultation.
Okay.
No bronchi, no wheezing, no crackles noted. I noted bronchial vesicular breath sounds at the top, also in this middle area, and vesicular down the rest. Okay. The next thing that I need to do is a vocal resonance. And the first one would be the bronchophony. So I need you to say the word 99 for me while I listen with my stethoscope.
Okay.
Okay? There we go.
99, 99, 99, 99.
Okay. So that sound was muffled and it was difficult to distinguish what was said. So that is normal. Next thing I need to do is the whispered pectorilatory. And I need you to whisper the word for me, whisper 1, 2, 3 for me while I listen. Okay? Here we go. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, so the sound was faint and muffled and almost inaudible. Okay, and the last one is the egophony. I need you to say the word EE for me. Here we go.
E-E, 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 E-E.
Okay, so I can hear that clearly through the stethoscope. So that is good.
Very cool.
Okay, the next thing that I'm going to have you do is I'm going to have you lay on your back for me.
Okay.
I'm going to move on to the cardiac area. Okay.
Sorry. Yep.
And it's probably going to be best if you would turn a little bit to your left side so I can evaluate your apical impulse. Okay, I'm going to use one finger and I'm going to go to the 4th intercostal space. I'm just going to palpate for that area. All right, nearing the left sternal border. And at the same time, I'm going to be evaluating for the PMI, which is the point of maximal impulse, point of maximal impact, I apologize. And that's also the 5th intercostal space, mid-clavicular line. Okay. Sounds good. Feels good. Now I'm going to take the palm of my hand and I'm going to palpate the rest of your chest.
Okay.
I'm ensuring that I don't feel any abnormal vibrations, anything like that. Okay, so no thrills noted. Okay?
All right.
All right. While you're laying down, I'm going to evaluate. I need to listen to 4 very important heart sounds. I'm going to be using the diaphragm of my stethoscope. I'm going to be listening to the atrial valve that's located in the second intercostal space on the right side, to the pulmonic valve, that's also the second intercostal space on the left side, the tricuspid valve, which is at the left sternal border, and the mitral valve.
Okay.
Okay?
Cool.
Start with the atrial.
Good.
Second intercostal space. Okay, nice S1, S2, regular rate and rhythm, no S3, S4 gallops noted. Moving on to the pulmonic valve. Nice S1, S2. No murmurs or S3, S4 noted. Moving on to the tricuspid valve. Left sternal border. This S1, S2. Regular rate and rhythm. And moving on to the mitral valve. 5th intercostal space, mid-clavicular line. Nice S1, S2, regular rate and rhythm. No additional sounds noted. Okay, I'm going to look at your carotids at this point, so I'm going to palpate. 2+ pulses noted in the carotid. No JVD noted. I'm going to listen. Okay. Moderate sounds. No bruit noted. I'm going to move on to the left side. 2+ pulses noted. No bruit noted. Oops, I need to listen for a sec. 2+ pulses noted. No JVD noted. I'm anticipating no bruit. Listen to that. Okay, good. No bruit noted. Okay, moving on to the peripheral. I'm going to evaluate the arms. Okay, no edema noted. Color is nice and pink. Skin is warm and dry. I'm evaluating the fingers. No clubbing noted to the fingers. Good cap refill noted. Okay, now I'm going to evaluate brachial pulse.
Okay.
Okay, 2+ brachial pulse noted. Moving on to the radial. 2+ radial pulse is noted. On the left. 2+ radials on the right. Evaluating the popliteal on the knee. 2+ noted. 2+ noted on the popliteal. Moving down to the dorsalis pedis. 2+ noted on the left. 2+ noted on the right. Moving on to the posterior tibialis. 2+ noted on the left. 2+ noted on the right. Now I'd like to do a quick Allen's test on you. So if you would, please open and close your hand for me. I'm going to be occluding the radial and ulnar arteries. I'm evaluating for perfusion. Okay, the skin is blanched at this point. I'm going to let go. And now the skin has returned to a nice pink color. So looks like your circulation is good.
Okay.
Okay?
Great.
So if you would please sit back up for me.
Good.
All right. You appear to be in excellent health. Your heart sounds good, lungs sounds good.
Perfect.
That's it.
Thank you.
Thank you.